Hello everyone. Today let's learn about the proton pump inhibitors. First let's see, what are proton pump inhibitors? All proton pump inhibitors are benzimidazoles. They controls the acid secretion. Omeprazole was the once-approved drug for use in 1989 after clinical trials. Omeprazole is the most commonly used PPI prototype inhibitor of substituted benzimidazoles. They inhibit the proton pump, H+, K+ ATPase. Now let's move on to the mechanism of omeprazole. It inhibits the final common step in gastric acid secretion, that is inhibition of H+, K+ ATPase. They inhibits the gastric mucosal carbonic anhydrase enzyme. The parietal cells of the stomach secrete H+ with the help of H+, K+ ATPase, and this is the final step in the gastric acid secretion produced by various stimuli. It gets tightly bound to SH group of the enzymes by covalent bonds and inactivated irreversibly, thereby it inhibits gastric secretion. Omeprazole is inactive at neutral pH. After absorption into the bloodstream and subsequent diffusion into the parietal cells, it gets inactivated in the acidic canalically to sulfenic acid and sulfonamide. It's time to learn about the adverse drug reaction. Prolonged acid suppression may allow bacterial growth in the stomach, resulting in increased risk of gastrointestinal infection. Elderly patients receiving PPI for longer time may have increased risk of osteoporosis due to reduced calcium absorption in the absence of gastric acid. Atropine changes in the stomach have been noticed after 3-4 years of use. 3–5% of patients exhibit nausea, headache, abdominal pain, loose stool, muscle, and joint pain, drowsiness. Drug interaction. Reduced gastric acidity decreases the absorption of ketocanosol and ion salts. Clathromycin inhibit omeprazole metabolism and increases its plasma concentration. PPI also inhibits microsomal enzymes that inhibit the metabolism diazepam, phenytoin, and warfarin. How PPI is used for peptic ulcer. PPI are used for faster and are more efficient for ulcer healing and pain relief. Duodenal ulcer heal at 2 to 4 weeks, whereas gastric ulcer heals 4 to 8 weeks. PPI are used for the patient who did not respond to the blocker. PPI are the drug of choice of NS and IDS-induced gastric ulcer. Omeprazole at the dose of 20 to 40 mg/d are more effective than H2 blockers. PPI for bleeding peptic ulcer. Acid enhancers clot dissolution that promotes ulcer bleed. Bleeding peptic ulcer patients have the risk of rebleeding after therapeutic endoscopy. Higher dose of IV PPI therapy, pantoprazole or rabeprazole or esomeprazole 80 mg bolus injection followed by 8 mg per hour infusion for 3 days. Suppression of gastric acid has been found to facilitate clot formation that reduces blood loss and rebleed. PPI for stress-induced ulcer. And pantoprazole or rabeprazole are effective as prophylactic stress and stress ulcer. It is also used GERD gives for 6 to 8 weeks. PPI for Zollinger-Ellison syndrome. It is a gastric hypersecretory state due to gastrinoma. Gastrinoma is high-dose oral PPI 60 to 120 mg/kg in 2 doses, the drug of choice for controlling syndrome. PPI for aspiration pneumonia. PPI are alternative to H2 blockers for prophylaxis of aspiration pneumonia due to prolonged anesthesia. If this video is useful to you, please leave it on the comment section. And thank you for your precious time.